So my name is Dr. Stephanie Wu, and I am the owner of the Contact Lens Institute of Nevada here in Las Vegas. My practice is purely specialty contact lenses, so about 75% of the patients I see are keratoconus patients. So obviously this fits in perfectly with what I'm doing. So just going to go through a case that we saw and kind of how we used Avellino. So we had a 10-year-old boy. He was referred to me from another doctor who, in a different city that was seeing him from year to year, just doing his annual eye exams. And as you can see, his prescription at a -12 with some cylinder in both eyes, that is very, very high for a 10-year-old. So after about a year, I think he started off at -11, and he was referred to me by his doctor. We fit him into orthokeratology. Orthokeratology is a special type of contact lens that you wear when you're sleeping, reshapes the front of the eye, and then it also helps to prevent the myopia from getting worse. Well, when I saw him back for his annual exam, he had increased by another diopter of myopia, which is not supposed to happen when you have an effective myopia management program in place. So instead of saying, well, we're just going to add another treatment, we are going to change design, something like that, we said, you know what, it just doesn't feel right. Something feels a little funny with it. So I said, I'm going to take a step back. Let's let him do a washout period so he's not wearing his contacts, his corneal topography can go back to its original shape, and then let's get him tested to see what are his risk factors for keratoconus. First of all, I don't like this prescription. Very, very high, and he's got some cylinder, and he's increasing every year despite methods to try to stop the progression of myopia. So those are some weird things that I was thinking of. He did not have any history of eye rubbing, any sort of allergy response, things like that that are also kind of involved with keratoconus patients. But I just didn't feel like this was a patient that I wanted to take a chance on. So after he did his washout period, here's just a topography, looked very similar to his to the left eye. But really what we're looking at is, if you look at the axial map, this is really the one that we can focus on. But it looks pretty normal. So I'm not looking at a giant red spot, the K max doesn't go past 47, so this patient does not look like they have keratoconus to me from their topography, but I just wanted to double check by doing the Avellino, and I talked to the parents and I said, you know what, I just don't have a good feeling about it. I want to just figure out what his genetic risk is because I don't like all of these things that are happening. So he came into the office, and like Joe said, super easy to do, especially on kids. With any sort of invasive test, I think it would be a lot more scary. But for him, it was super easy, and it was very, very easy to do in office. So this is his report. So as we can see here, he has a risk score of 3, so his risk of keratoconus genetic-wise is very low. So the way this helped me with my treatment is I said, okay, well, we know that his genetic risk factor is very low, his topography is not really showing signs, so I felt comfortable putting him back into orthokeratology lenses. If this was different, if he was on the high scale, there's absolutely no way I would put him back in an ortho K lens. I don't want anything touching his cornea that could possibly make things worse. And I would get a pentacam image on him every 6 months probably, just to double check to make sure that the posterior cornea wasn't having any changes. So this was a great test for us, and as parents, just so we can all figure out a really good game plan for him moving forward. So this is just one way that we use it in our practice. Like Joe said, amazing for patients that have keratoconus and they want to find out if maybe their siblings or their children, any other relatives are at risk, things like that. So I definitely think this is an amazing innovation, really, really great for not only keratoconus patients, but refractive surgery, patients where you just don't feel like you just don't have a good gut feeling. I think this is a really, really good test to do. And then this patient, he's so cute. He actually is on my Instagram, Dr. Stephanie Wu, And he goes through and he talks about Avogen, and I ask him a bunch of questions, so you can hear it right from him on what he thought and how it's painless, it's really easy. So a lot of times I'll refer some of my patients to watching that so that they can feel comfortable doing it on their own kids. So yeah, that's our case, and thank you so much.